Good morning. This is Dr. Bill Wyatt again with the American Orthodontic Society, and we're going to talk about an appliance that a lot of people use, and you can take advantage of it if you want to. It's a Herbst Appliance, and this is a gadget that you put on the teeth, or you can have a removable Herbst Appliance that will project the jaw forward in here. And a lot of people with TMJ problems where the jaw is back too far and the condyles are pressing into that retrodiscal tissue, and they put something in there to move the teeth forward, and so they can use a Herbst Appliance. Now, when you move teeth and you've got a fairly deep bite, and if you move the teeth out here, you've got a gap between here. And if you bite or chew with your front teeth and you have space in this area right here, the load is on the condyle and the front teeth. So you don't bite too hard out there to do that. So if you do it any hard biting, you get back here where the teeth are right over the muscle, it'll pull it right down against the bone rather than against the condyle and the fossa back here in the back. So with a Herbst Appliance, and you use them on young kids and things, you can just project their jaw forward, and their teeth don't have this overbite very much, and they'll just wear this and it'll bring the teeth forward. Now, you do not make the person grow more jaw when you do that. What happens, the condyles back here where you've got a neck on the condyle, it will move backward, and that carries the jaw forward. And the gonial angle right in here in your jaw gets bigger. In other words, it levels it out and that pulls it up. And if you hold it there long enough, now people have taken this and put it on young people that have deciduous teeth, and the deciduous teeth don't have enough cusp on them to hold the jaw in that position. And so they're just flat. And the Herbst Appliance you can put on them and wear them 6 months or 8 months. It'll pull the jaw out here. You take them off, and the jaw will go back where it was. Now, if somebody's got a deep cusp, let me show you like you had a, well, let's see. Say if you have a tooth like that, and your other teeth in the deep cusp, and you bite down in a certain position, the cusps kind of guide your jaw to this forward position. If your teeth are just flat, they don't do this. And the deciduous teeth don't have enough cuspal inclinations to keep the jaw up there, so the Herbst Appliance doesn't work too well until they get their permanent teeth in. All right, let's get looking at some of this. This is it's really a simple deal. It's no big deal, is it? The only thing you have to have everything lined up and tied up. See, if you push back on this right here, now when the person opens, you have to see this is a pipe right here, and this is a rod going into the pipe. And so as the person opens their mouth wider, this slides back in this direction. And you have to get your teeth lined up really to do that. You can actually advance the mandible, everything, by wearing a retainer with a big ramp on it, where it goes like this, and the person bites on that, and it may have to bring their jaw forward to be able to close the teeth together. And that's what we normally do. We've been doing that, correcting TMJ problems, getting the condyle out of the way of the retrodiscal tissue. Now, if we take this, and this is a picture, is not, these are not my pictures, they're some that I got at a course like that. But here is the shaft, and there's a stiff wire inside that. And wherever you want it to stop, you grind this off right here, and it'll hold this jaw forward when they close together. And up here, this holds this jaw back. It doesn't let it go. So it pushes it backward on this one and forward on the other joint to correct the class 2 problem. Now, that's still out of, all right, this is a little better. You've got a bar coming out of this that you run in here and you bend it over and wire it in, and that holds this right back in this direction. Now, as they close to, this shaft goes into the pipe, and it holds this jaw at that point. It can't go together any further than that. Now, I would rather have something you could remove if you wanted to work on it, but you've got to have everything lined up with a Herbst Appliance. You could use them, but you've got to have a full orth wire in there, keeping the teeth together and everything else, or you just push the anterior teeth out away from it. And there's another picture. It's not too good either. Now, this is a removable Herbst Appliance. You can get this. It's kind of hinged back in the back, and the teeth are covered up. Just remember, if you've got any depth of bite in here, like your overjet and overbite, if the overbite is too much and it's closed, and you advance your mandible out here, you don't even have it too much. If you bring your jaw forward and bite your teeth together, your back teeth do not come in contact. So when you bite something off, you bite with just the pressure out here, the condyles move down on at the back and on the high part of the eminence back here, and that keeps the teeth apart. Now, if you want this to grow and get somebody, keep them from having problems, you got to build this to where it fits against this when they have the jaw forward. And they'll have to hold their jaw when they've got that out there. That takes the load off of the condyle back here and puts it on the teeth right in here, so you're putting bone against the bone, you see, and you can take a lot of pressure that way. I hope this is, I think that's the only picture, yeah, that I have, and I hope this is enough to do this. You can send this to a lab and they'll make your Herbst Appliance. It's hard to construct these unless you have somebody that knows how to do this. And I don't really care for them for TMJ patients, but it's something that they would wear all the time. We prefer just to make a ramp up on your split that you wear that they can't get behind at night, and during the daytime we just wear another one that's kind of slightly out here, but you can't put your teeth together till you get them out past this ramp. So I hope it's this people that are concerned and want to use the Herbst Appliance. It is a good jaw propelling appliance. You can put this on a kid and in 6 months or just later, less than that, they'll bite back here and then they'll be biting forward up here. If you turn them loose, they don't have enough cusp to keep them out there, and they'll slip back in that fashion. So thanks for watching. I hope you get something out of this video, and we would appreciate you subscribing to our circle. So thanks for watching, and I'm going to say goodbye.